Hello and welcome to the Mental Health Hub. It's another Tuesday of learning together. I want to really appreciate the opportunity to serve you, the opportunity to be able to share and encourage one another and even get to unravel more about issues mental health. Because at the end of the day, you need your health for you to function well, for you to be able to deliver on a daily basis, for you to feel worthy, for you to feel really you affect your world, for you to experience your world optimally and have good experiences in life that will actually make you be able to live a life that is pleasing, not only to yourself, but even to the people around you. So I want to really say I am enjoying every bit of this. Every time we interact, I get to also learn from your sharing for your experiences. And as we have been building on the issue mental health, and more so substance use disorders, today I want to look at an aspect of other conditions that co-occur with substance use disorders, which are also mental health disorders. As you know, when a part of the body is not functioning, oftentimes there are other conditions that take advantage or could coexist with that other health problem. And that's why it's good to understand that the person with substance use disorders would also have other conditions that therefore would actually complicate even management of the substance use disorder. That is why it is important to understand that at times substance use disorder is not the only burden or health challenge that one could be dealing with. And that's why it is important to be able to even support this person, even be able to yourself seek help, because you may not only have the substance use disorder, but you could also have other disorders or medical conditions, if I may use it broadly, so that I'm not only looking at the mental disorders, but other health problems that one could have alongside the substance use disorder. And this makes the life of this person less functional, less good, or more uncomfortable on a daily basis, therefore complicating the matter for them. Substance use disorder, as we know, is already recognized as a mental disorder. Alongside the substance use disorder could be that this substance use disorder is caused or contributed to by the fact that this person has another mental disorder, either recognized or diagnosed or not even diagnosed. What am I saying? You may find a client who has anxiety disorder. And because of anxiety, this person, the day they experimented or took a drug of choice, the drug kind of helped them to calm down if they have anxiety, or to have their mood lifted if they have a mood disorder. So they will continue using the substance that of choice, but then what many people will notice is the fact that this person is either an alcoholic or an abuser of bank, or is an abuser of heroin or cocaine. They will oftentimes not realize this person as another mental disorder that also requires to be treated. So some of these mental disorders that co-occur with substance use disorders include anxiety. They include depression. They include schizophrenia. They include other mood disorders like psychotic disorders. It could be also a personality disorder that could underlie or occur with the substance use disorder. On the other hand, the fact that one has a substance use disorder, it can also lead to developing of another disorder or another sickness, like anxiety disorder, like also psychotic. So you find that this person doesn't only have one mental disorder, so they could have two mental or disorders occurring at the same time. On the other hand, one could also have a physical illness, like one has a substance use disorder, but because either of abusing substances, they compromised the immunity of this person to an extent that the body started developing other illnesses. An illness like diabetes could be because caused by a substance or influenced. Its development can be influenced by the fact that this person is a substance use disorder. On the other hand, even high blood pressure, because we know substance use oftentimes compromises the organs of the body. So if the organs of the body are compromised, like the pancreas, like the blood vessels, like the stomach, like also the lungs, it could also lead to development of physical illnesses. So that you find this person has liver cirrhosis and has a substance use disorder. This person has a pancreas that is not functioning well and also has a substance use disorder. This person could be having ulcers and also have a substance use disorder. Why is it important to be able to look at it this way? So that when we are, first of all, doing the assessment for somebody with a substance use disorder, we also want to assess what other condition could this person be having. That is why it is important for a professional to address these issues, so that in case you identify another mental illness, it is also treated alongside the substance use disorder. So that if you identify a physical illness like blood pressure, like diabetes, like a malfunction in the lungs, or a malfunction, a cancer that is developing, this person is also treated for this other physical illness. That is why it is important to be able to understand that this person who has been identified to be addicted, this person, as you look at your significant other or a colleague at the workplace or as somebody you are responsible for, and you find that this person requires treatment, know that it is not only the treatment for the substance use disorder that is significant only. We also need to be able to establish what other condition, health condition, can this person be having, so that as we treat one condition, the others are also being treated, so that you are not taking somebody for rehabilitation probably, and a physical illness is not being treated. Look at substance use disorders like alcoholism. When somebody is abusing alcohol, abusing a substance, heroin, cocaine, their decision making is affected. So even health conditions like HIV come into play because this person engages into risky behavior that could predispose them to developing a condition like HIV. This person could be even an injecting drug user, and you know the risk of sharing the injections that this person could be involved in. You know that this person is not able to make a decision when they are intoxicated to even use protection. They are at times not able to make a choice of who they are having sexual intercourse with, so that this person cannot even protect themselves. So they put themselves at a risk of developing or getting infected with a blood-related disease, including HIV. They also find that you find this person also could be having another sexually transmitted disease. So it is important for a proper diagnosis, virtually all aspects of the life of this person. That's why during assessment, a lot of questions are asked. During assessment, the professional is able to work for a good period with the identified patient to be able to establish, could there be another health problem, so that we treat this person holistically, so that we can be able to treat the whole person. As we treat the psychological conditions, we are also treating the physical condition that this person could be having, so that the person is able to bounce back and be in a healthy state for them to function to a good level of functionality for purposes of them being able to live quality life. On the other hand, if one condition is left untreated, it will definitely be deteriorating. So as you manage the substance use disorder, you have maybe a physical illness that is deteriorating or progressing. So if it is not identified early also, it could progress to an extent that it can even be fatal if that other physical illness is not treated. That is why it is important, as we do a diagnosis, as we do an assessment, we are able to establish, or we want to establish, is there any other illness that this person could be having, either physical or mental, or even, physical, mental, psychological. Because oftentimes you may find one could be having a mental disorder, but also alongside other psychological problems that are actually disturbing them, so that we are able to bring this person to a point of functionality, because they are looked at holistically, so that we are not losing people to managing the substance use disorder, but also having a physical health, a physical illness that is actually going to affect the wellness of this person. On the other hand, it reduces the disease burden. How does it reduce the disease burden? It will help us to diagnose a condition early enough. When all these conditions are diagnosed early enough and they are managed, probably before they become severe, then it will mean that this person is not spending a lot in medication. So it will reduce the disease burden to the individual as well as to the family. It will also help this person recover faster. So if all these health conditions are found, two or even probably you don't even have any other condition except the substance use disorder, then it makes this person is able to bounce back faster and be functional faster, and therefore they are able to go back to their routine of working, to their routine of relationship, to their routine of being useful to the community and being able to deliver on their mandate or on their daily activities, and therefore becoming very productive. That's why I want to emphasize the importance of, again, a professional or professionals being involved, because besides working with this person as one professional alone, you are able to bring alongside other professionals that will be able to help this person live a better life. As a psychologist, when I do an assessment and I'm able to establish there is likely a physical illness that requires to be diagnosed, then you bring in a medic so that the medic is able to actually identify or run the necessary tests to find, does this person have HIV? Could this person be having diabetes? Could this person be having blood pressure? Could their liver be okay? Is the functioning of the kidney okay? So that if all these things are okay, then the person is not put on medication. On the other hand, the psychiatrist is able to establish, if working with the psychologist, is there any other mental disorder that needs also to be treated so that this person can recover better. On the other hand, we bring even other experts. When you discover or during the assessment, you find out that this person requires to be taught other self-management strategies, like how to manage hunger. That will be dealt with. If the spirituality of this person is also wanting and they feel spiritually they need to be helped, then you bring in, or you have somebody else who can be able to handle that bit. So at the diagnosis or the assessment level, at this point, you are able to identify who is the other helper that will be needed to be able to help this person live a better life. So the emphasis on identifying other co-occurring disorders with the substance use disorder comes in very handy and becomes very, very important for treatment and management of substance use disorders, both for preventive, because you can be able to prevent another disease, for curative and also promotive reasons. It is important to be able to establish holistically what is the health status of these clients that I have, so that I can be able to support them efficiently and actually effectively for better management of life and also resources, considering that substance use disorders management is resource intensive, so that we are able to help the family also manage the resources better. In case there is an health problem that needs to be dealt with first, can be dealt with before it deteriorates and therefore eats more and more on the resources of this person or of the family involved, as well as other institutions that are actually paying for insurance for the persons to be treated for substance use disorders. Because we know today there are insurances that are taking care of treatment and management of substance use disorders. It cuts on the costs when a condition is discovered early and managed before it progresses to a severe level and therefore requiring more of resources. Besides, helping this person recover so that we are not losing people to substance use disorders, so that we are not losing people who are resources that are important for running organizations, for running government, for establishing families, so that we are not losing people early. We are not losing people untimely because of situations that can actually be managed on time. Therefore, I emphasize the importance of establishing, is there any other co-occurring disorder or disease with this person who has been identified with a substance use disorder. That's bring the importance of bringing in professionals on play, so that you are not saying, I have a patient or I have a client who has been abusing substances for so long and they just abruptly decided to stop, and I think that is a good thing. Even if this person has stopped, take responsibility, let them be assessed so that we can, the doctor can be able to help you establish, is there any other part of the body of this person that requires attention, so that they don't stop using alcohol, they don't stop smoking, they don't stop using heroin, and 2 or 3 years down the line, they have died because of a liver condition that was not diagnosed, because of a kidney problem that was not diagnosed, or because of diabetes or high blood pressure that was not diagnosed, because this person just stopped abruptly themselves and you felt that was good. Thank God it is over, but then what else needs to be established? It it is important that we are able to do the right thing for purposes of people living long, people being managed well, and also good testimonies arising from proper management of substance use disorders. I wish to say thank you for today, and I look forward to another interaction. Remember to like, subscribe, and share this content so that we can reach more and more of us and be able to develop a community of people who are responsive to health management. Thank you, and see you next time.